Good morning. I'd like to call the 4th Osage Nation Congress to order. We're in the SHUSO session. Today is September 14th, 2015. It's 10 a.m. and we are on day 6 on the agenda. First item on the agenda is prayer. Congressman Yap, would you please lead us in a word of prayer this morning?
Yes. Dear Heavenly Father, we want to thank you for this day. We ask, Lord, that you lead and guide us through this meeting, Lord. Give us open minds, open hearts, make good decisions for the Osage Nation. We want to thank you, Lord, for all the blessings you bestowed upon us. We ask that you watch over us, our families and friends, watch over our children, our elders, watch over and keep us safe, Lord. Be with those in mourning, be with those, Lord, overseas, serving our nation, those here at home serving our nation, Lord. Be with their families. Give them strength. We ask these things in Jesus Christ's name. Amen.
Amen.
Thank you, Congressman. Roll call.
Congresswoman Buffalohead. Congresswoman Edwards. Present. Congressman Hamilton.
Present.
Congressman Yak.
Present.
Congressman Maker.
Here.
Congressman Mason. Congressman Norris.
Here.
Congresswoman Pratt. Present. Congressman Shaw.
Here.
Congressman Supernall.
Here.
Congressman Walker.
Here.
Speaker Whitehorn.
Here.
Assistant Chief Redcorn.
Present.
I'd like to mention that Assistant Chief Redcorn's being courteous. He has a cough today, so he's going to be here with us, but he's going to sit down in the audience. Next item on the agenda is approval of journal.
Motion to approve journal, September 10th. Second.
I have a motion and a second by Congressman Shaw. Any discussion? All in favor say yes.
Yes.
Journal is approved that was the journal for September 10th. Next item on the agenda is, it's the time of year that we have our annual audit for FY14. Treasurer Callie Ketcher, I would like for you to come and give the introduction for the representative from BKD, CPA and Advisors. Good morning.
Good morning. Thank you, Madam Speaker. I'm pleased to tell you that the 2014 audit went very well, and we have with us Joel Hauser. He is, what's your exact title?
Audit Director.
Audit Director for BKD. This is the second year they've done their audit for Osage Nation. And I'll turn it over to Joel to do the presentation.
Thank you, Mr. Hauser.
Yeah.
Thank you. Glad to have you here.
Thank you. I'm glad to be here.
Just continue on with your presentation as you need to.
Okay, great, thanks. Again, I'm Audit Director with BKD out of the Tulsa office, Joel Hauser. I've been working for BKD for about 10 years now, 15 years of experience in the public sector. And I wanted to, first off, congratulate you guys on your new campus that you're building. It's pretty nice, pretty lovely. And I'll go ahead and start with the presentation. The main point was just to explain the reports that we issue, not really get into the details, let you know of the audit results from June 30, 2014 that was wrapped up earlier this spring. And I kind of get started off with a little bit about who we are. We're one of the largest CPA firms in the United States. We've got approximately 250 partners. We have 33 offices in 15 states and 3 offices here in Oklahoma, Tulsa, Oklahoma City, and Enid. Pretty large CPA firm. A little bit about myself. I'll leave it on there and let you guys read it. But it's got a little bit of my experience, and one of my specialties is really the single audit, which is for federal compliance. Quite a bit of work around the state for that. But we'll get started with the reports that we issued. We issued an audit opinion for the Osage Nation financial statement audit. We also issue opinions on the single audit, which is the federal awards and compliance. We issue an audit communication letter, which explains the results of our audit, a little bit more details. We also issue a separate audit on Osage LLC, which rolls up into the Osage Nation's financial statements, and we issue a separate audit communication letter for that as well. This slide shows kind of the key elements of our audit reports. Our audit opinion letter is probably one of the most important, and I can give you page numbers of those if that would help, but the audit opinion in the financial statements is on page 1 of the financial statements, right after the table of contents. The management's discussion of analysis is probably what I like to say is the most important piece. If you don't read anything in the financial statements, which are pretty long and intimidating, please focus on the management's discussion and analysis, which begins on page 4. And that'll give you a brief overview of the financial statements and what happened, the audit results and the opinion for the year. On page 12 is where the actual financial statements start. And these are called the government-wide financial statements. Probably the second most important would be on page 14, which are the fund financial statements, which are really the cash basis of each one of these funds, the general fund, the various federal compliance funds, Department of Health, Department of Transportation, take you on a cash basis. And then last, page 16 begins the notes for the financial statements, which is pretty much look like they go on forever. And then we also issue a single audit report, which was separate, and it has 2 reports within it that we issue opinions on. There's also the schedule of expenditures of federal awards, which those are all of the expenses from the federal government that were spent during the year. There's a schedule of findings and question costs, which if we had any findings or anything to report, they would be in that section. And lastly, there's a summary schedule of prior audit findings, which were audit findings from previous years that had not been fully taken care of. At this point, I believe there was only one, which is is pretty good considering I think there were 8 at one time. So those have been cleaned up. And then to get to the meat of it, we did issue a clean opinion on the financial statements, which is referred to as an unmodified opinion. It was the second year, I believe, for an unmodified opinion, which is great. It's the best one you could get. One thing we did want to point out this year, there was a restatement, what we call. Basically, there was a change in the reporting entity, and the Indian villages in Gray Horse, Pawhuska, and Hominy have previously been accounted for as expenses. But this year, kind of decision of management was that those were so close to the government that they were reported as part of the governmental entity. So those assets that were in the villages are now part of the financial statements of Osage Nation. So that was probably one of the biggest changes for the year. Yes?
What makes you decide to do that?
Accounting standards. There are accounting standards in play, and most of the decision of that is judgmental based on management. We got the Attorney General's response and kind of her recommendation as to how that should be reported. And ultimately, it comes down to an accounting decision, is really where that comes from.
Thank you.
We don't audit the Osage casinos. Those are audited by another accounting firm, but they roll up into the financial statements. So we reference those auditors in our opinion, so we do not audit the casinos. We also issue clean opinions on the federal compliance requirements for all the major federal programs, which again is great for the nation. In the past, there have not been clean opinions, but the past 2 years there have been, and I'm pleased to report again this year there are. We did have one significant deficiency, and I guess kind of back up, whenever we have findings that we report, we classify them into 3 different buckets. Material weakness, which is the worst, which means there's a significant error in the financial statements that we have found. A significant deficiency is not quite as bad as material weakness, but it still warrants the attention of management. And last, there are deficiencies which are not significant, but still areas that management can improve upon. We didn't have any material weaknesses this year. We did last year, but that was taken care of and cleaned up. We did have one significant deficiency, which was a little unique because of the building of the new complex. There's a retainage calculation for when construction takes place. You don't pay all the construction invoices at once. Usually you hold on to about 10% of those until the project's completed, and those are referred to as a liability until you pay them. And we found an adjustment that needed to be made. And so, again, it's not a material weakness, but it's one that management has taken care of and put controls in place to correct. And we did have a few deficiencies which are listed in our management letter, which is one of the letters that you received. And lastly, we also issued a clean opinion on Osage LLC, their financial statements, and they also have a separate management letter issued with that. And in closing, we received good support from the Treasurer's Department and have been pleased to work with them. They work very hard and have worked really hard the past couple of years to clean items up and get everything taken care of. Again, we've got significant improvements in internal controls. There's still room for improvement, and there usually always will be. So we'll continue to work with management on that. And again, a good report on the compliance with the federal programs administered by the nation. Just want to say thank you. Here to try to answer any questions you may have.
Congresswoman Edwards.
Did you say you issued an opinion with respect to Osage LLC?
Yes, their financial statements.
What about our other enterprises?
Which ones? The casinos are audited.
ONES LLC?
It's included with the financial statements in here. We don't issue a separate opinion on it, but it is incorporated into these financial statements.
Why?
There's no requirement to have one, and it's management's decision ultimately. Sure.
What about
Kelly, you want to?
Osage Home Health Inc.?
It's also included in these financial statements, but a separate opinion is not issued.
And are you doing that on the basis that the Osage Nation is the member of these LLCs?
Yes. They are part of the reporting entity for Osage Nation.
So you've got, do you have every LLC that we have included somewhere in these financials?
I'm not sure if we have everyone.
Anyone? Osage?
Most of them probably would be.
Osage LLC, Osage Home
Home Health.
Inc.
The foundation is also included
Okay,
in the financials.
okay.
Again, Marge.
Okay. But you decided, somebody can tell me why you decided to do it separate? What did you call it, separate?
A separate audit for the LLC. A separate audit for the LLC is required under their structure, their audit committee charter, and their, essentially, I guess it's their bylaws require an audit to be performed. And so a separate audit is prepared.
We didn't require that in the other LLC documents?
Not to my knowledge, they're not required to have a separate audit.
And did we charge the cost of that separate audit back to that enterprises, or is that something?
Kelly will have to answer that question.
Madam Treasurer.
Thank you, Madam Speaker. Osage LLC engages BKD separate to do their audit, and so all of those expenses are paid for from Osage LLC. Home Health and ONES are relatively small, but because of the accounting rules, we have to include them in the overall Osage Nation audit. So our audit firm performs some procedures on those two entities and includes them into our audit. And all of any cost related to that is included in our audit fee.
But is the distinction that they're small, or I'm having trouble with this distinction because I don't see it, as far as I know, when we created these, we didn't try to make a distinction between how one enterprise was going to operate and how another one was going to.
I think the distinction is really size, and to my knowledge, as Joel stated, the bylaws of Home Health and ONES do not require a separate audit report, and neither does the foundation right now. At some point, if the foundation continues to grow, they're going to hit the IRS limit for requiring an audit.
What is that one?
I don't know off the top of my head.
But is it, so it's assets or how much you make? Because certainly Osage LLC is right there with the other two.
Typically, it's assets, but again, I can look up the information and
I'm just
get
curious.
that to you.
I'd like for us to be looking at, I'm struggling with, for example, the accounting of ONES anyway, because at times we've asked them for financial statements, and they've been saying they've been relying on the nation to prepare their financial statements. And I didn't understand when we created a separate legal entity that was supposed to be, out making money, that it would be relying on the nation's finances as much as it could to continue to operate. So I would like them all to be treated the same if possible, but maybe determine that there's a reason why they aren't.
I could address ONES as a courtesy because they were so small. I drafted their financial statements for them in 2013 and 2014. Again, it goes back to what is either legally required or what is in their bylaws. I have to have them at least reviewed by our audit firm so that they can be included in our audit. So that's why the Home Health and ONES and the foundation all have procedures performed by BKD so that they can be included in our audit report.
And because of that, legally, does that expose us to any greater liability than it would if we didn't do it that way?
Not that I'm aware of.
Okay.
I have a question from Congressman Yannick.
It's not a question, it's just a comment. On page 40 of the this audit report, I'm looking at it, note 4, it kind of explains, I think that might explain kind of why they're reported the way they are.
Thank you, Congressman. Any more questions? Congressman Supernaw.
Just on page 4, looks like you dropped the last 3 zeros on all these figures. Is that consistent or just that one page?
Madam Treasurer,
Yet on that page, everything is rounded to thousands of dollars. That's the financial highlights.
So is it the Osage Nation charter that, enterprise charter that's causing you to not include the gaming enterprise in the audit? Or is it the law? Or what is it?
Just to clarify, the gaming enterprise is included in our overall audit. It's just that they have a separate audit, and they use a different audit firm than the nation uses. And that's why Joel was referring to, they reference this other audit firm's opinion when talking about the gaming operations. Gaming operations are required to have an audit for NIGC, and then they also have the financial audit, which is included in our audit report.
So I believe for the most part, on page 12, there's a component unit column. That component unit column is primarily made up of the casinos. There's a footnote. Find it real quick. Yeah, I don't think we break those out separately yet, but primarily those are the casino numbers.
What is business type activity in primary government then?
Under primary, the governmental activities, management classifies, and this is based on accounting standards, we'll classify each one of the functions, whether it's a fund, like the general fund would be a governmental activity, or if an enterprise is primarily geared towards a business environment, it would become a business type activity. And there is, on page 16, is a list of essentially the governmental activities. And then if you'll go to page 18, those are the business type activities that roll into that first page. The accounting standards and the way you account for them are slightly different for the governmental activities, so those numbers won't agree exactly. Primarily, capital assets and debt are not included in these back schedules.
So are the component units the casinos and the LLCs?
Not the LLCs. It'll be, some of them are and some of them are not. It gets very confusing. ONES and Osage LLC are considered investments of the nation under accounting standards, and so they have a separate footnote.
What about Osage Home Health?
Home Health, the foundation, and Osage casinos are the distribution component units. If you look on page 22, it will give you each one of those entities separately, their financial statements. And so you can see each one of those individual entities separately. And then on page, find it real quick to show you ONES and the LLC. They begin on page 41 of the footnotes. Are the condensed financial statements of Osage LLC and ONES. And again, they're not audited separately, but we do have to have certain procedures in place to test those since they are part of the reporting entity. So you wouldn't get the same look and the same audit as if they were separate, but there is some review of those entities during the audit.
But why would, I still don't understand the distinction between a business that's a corporation and a business that's an LLC being put in different places in our audit.
It goes back to the accounting standards. In general, if the Osage Nation starts an entity with its primary purpose to make a profit, then it's considered an investment of the nation. Whereas home health and the foundation really aren't geared toward making a profit. They're geared toward providing services to members of the nation.
Who told you that?
That's just the general conception of those types of entities. Since they are providing services, they get classified as not as investments, but as component units. And again, it is accounting language. There's not any leeway as to how they get reported, so to speak.
Ms. Gatcher, did you have something you wanted to add?
I was just going to point out that it all comes down to the Government Accounting Standards Board and how they define different types of entities that a government can own. I'll be happy to send you a copy of that relevant GASB statement if you've got a couple hours.
No, but I mean, no one's ever told me that, sitting in this chair, that Osage Home Health was not an entity that was established to make a profit and be a business entity of the Osage Nation. I know it struggled to do that, but so are all our business models, but.
And I'm sorry, and that's just one of the criteria that you look at when you're going through and evaluating. It really comes down to which column of the financial statements do they end up in. That's why in the notes to the financial statements, we make sure that we give you the detail of what's under component units and what's accounted for as an investment.
Thank you.
What about tall grass? Is that because wasn't established at the time that this audit was takes place?
That would be correct. I believe that was set up last fall, October, November timeframe.
Yes.
This audit was through September 30th of 14.
Will it be a component unit or will it be a?
We haven't evaluated that yet, but it will be evaluated.
Do any other members have questions for the auditor? Congressman Supernall.
Why would you look here to see what the loss is on health insurance or profit, if you want to call it that? The self-insured insurance that we have.
On the self-insured fund, there is a footnote on page 46.
26?
46. Page 46 and 47. That note 8 is the detail of the self-insured plan. And on the top of page 47 is probably the information you're needing, the current year claims that were paid for the prior year and the current year.
So for the year 2014, we have a balance of $1,150,000.
That's the amount that had to be paid at year end. For the whole year 2014, it was $3,889,110 were the claims paid during the year, which also includes that accrual.
I mean, we have an excess of $1 million over our collection.
Oh, over your collections? No, that will probably be explained better. The internal service fund on page 19. A column over on the far right, governmental activities, internal service funds. And that will show overall there's a deficit in that fund of about $775,000.
Oh, that's where that comes from, at the
Yes.
bottom there, 775,000. Is that just the health insurance?
Yes.
Oh,
That is just the self-insured health plan.
so
And if you'll recall, we've struggled with this self-insured plan since I've been here. I came to Congress the first year I was here and asked for a $500,000 supplement because we were running in the hole. We have been able to manage it on a cash basis, but it's very tight. We've increased the premiums that we basically charge to all the programs. And in fact, we have a meeting today with the insurers, some ideas to reduce our claims. But this particular fund runs very tight. Now, this is on a full accrual basis. That means that we've estimated claims that were incurred at September 30 that we haven't even been billed for yet. We actually had a slightly positive cash balance at the end of September 30. If you look at the previous page, we had a little over $222,000 in the fund, which meant that our collections were at least sufficient to cover the claims that had come in. But it is a struggle to manage this fund because we're self-insured.
You said it's very tight, but it looks to me like it's a loss.
Well, that's on a full accrual basis.
Well,
And
consistent, you always,
we increased the premium to the programs for 2015 to try to recoup some of that.
well, thank you. That makes me think of something else. Is there anything else in this report that you would call our attention to if we were smart enough to ask?
One thing that we, usually the key number that we always hear to look at is on page 16. And that is, what is the, I'm not, sorry, 16, page 15, no, 14. On page 14, we'll give you the general fund, of course, is the primary operating fund of the financial statements. And down at the bottom, there's a section called fund balances. And one of the primary numbers to look at is the unassigned number. That essentially lets you know of what your reserves are at year end. This year, it's actually a negative amount of 1.3 million. And one of the reasons for that, I believe last year was about 5 million, but one of the reasons it went as to a deficit number is because when the notes and the debt were issued for the new complex, a CD worth $5 million, and again, up above under assets, restricted investments, there's a $5 million number. Because it's being used as collateral, it ends up coming down to the restricted fund balance side because it cannot be taken out while the loan is being used essentially until that loan is paid back. And that's one reason that caused that deficit. But that's probably, within all the financial statements, one of the most important numbers is to keep an eye on. And that's a change over time, not necessarily one specific year, but over a 5-year period, if you continue to see your unassigned fund balance dwindle, then that could be a sign of problems. And so I usually pay attention to that number every year. This year, I wouldn't have a lot of concern. That's not a huge deficit. And again, a lot of it is because that CD is restricted. But that's probably what I would say is one of the most important numbers to look at.
And you did say in 13 it was 5 million to the good?
I believe it was about 5 million.
Yes.
I think the switch was because of that CD
Okay.
being used as collateral. And when that note gets paid off and that collateral gets released, that number comes back down into unassigned.
Is there anything else there that you might want to point out?
I don't believe so. from my experience, I don't have any concerns other than watching that number. And we'll see once that note gets paid off if we've got, additional dwindling, but I don't have any other concerns at this point.
Any more questions from members of Congress? Congresswoman Pratt.
I don't have a page 48. Is there something missing from it, or is it just skipped over?
And the financial statements,
That was 47 to 49.
I'm not sure.
Maybe it was numbered incorrectly, or I just wanted to make sure something wasn't missing.
Now, there should be a page 48. Yeah, it looks like it's missing.
I got it in.
Is it in the bound copy?
Yeah, it's in the bound.
It's in the bound copy, okay, we'll have to get you a page.
Congresswoman Pratt, I think all members have been supplied a bound copy. We just put this on the table for this
Okay.
review, but you should possess a bound copy of this audit. Is that correct? So, you should have page 48. Any more questions? Congressman Walker.
I think it's just as simple as it looks for work. Shows where contributions were made to 401ks. It shows there's been a higher contribution made by the employees rather than the nation. That's simply because some people choose to contribute more than what the nation matches. Is that the reason?
Likely, I might need Callie to assist on that detail, but typically, yes.
Congressman, what page are you looking at in particular?
49.
49. Ms. Ketcher?
Yes, that would be my answer. The nation matches the first 5%, but employees can contribute up to the IRS limit, which is $23,000 a year. So for some employees may be putting in 20%, and they only get matched on the first 5.
Any more questions from the members of Congress? Thank you so much for your time. We really appreciate that.
Definitely, and if there's any questions that come up, my contact information is on that last slide. Don't hesitate to contact me. I'll be happy to answer any questions.
Okay, thank you very much. Appreciate it. Next item on the agenda is reports of select committees. There are no select committees to report today, so we are on reports of standing committees. Congresswoman Pratt.
Good morning. The Cultural Committee met on bill number ONCA 1575, an act to protect human remains, funerary objects, graves, and cemeteries, and to establish an alternate effective date. The sponsor is Congressman Maker. The final committee action was due pass with 6 yeses from Pratt, Hamilton, Supernaw, Norris, Buffalo Head, and Maker.
Thank you, Congresswoman. ONCA 1575 is referred to is advanced to general order. Next item on the agenda is introduction of bills and resolutions. Are there any bills or resolutions to be introduced? Seeing none, we are now on bills and resolutions on first reading. Congressman Shaw, I believe you have a bill to be read.
Thank you, Madam Speaker, members of Congress. Reading in ONCA 1597, an act to require the Osage Nation to utilize drug testing protocols to ensure the proper collection and interpretation of test results for the benefit of employees and to establish an alternate effective date.
Thank you, Congressman. ONCA 1597 is referred to the Health and Social Services Committee. We are now under agenda item number 9, bills and resolutions on general order day 2. Amendments may be proposed. The first piece of legislation is ONCA 1574, an act to amend the Osage Nation Office of the Attorney General Act at 15 ONC Section 3-107 to charge the Attorney General with implementing amendments to the Osage Nation Constitution, and then to publish the updated document and to establish an alternate effective day. Are there any amendments to be proposed to that bill? Seeing none, ONCA 1574 is referred to engrossment. The next one is ONCA 1580, an act to provide for an appropriation to the legislative branch of the Osage Nation for fiscal year 2016 in the amount of $2,407,117 and to establish an alternate effective date. Congressman Yates, the sponsor. Are there any amendments to be proposed to that bill? Give me 1 moment, please. I'm going to read the correct amount of that title into the record. It's not correct on this agenda. It is $2,399,118 would be the correct amount. I should have read. The rest of the title would have been the same. Are there any amendments to be proposed to that? Seeing none, ONCA 1580 is referred to engrossment. We're now in motions and notices. Congresswoman Edwards.
Move to suspend the rules, modify the agenda in place ONCA 1574 and ONCA 1580 on third reading on today's agenda following engrossment. Second.
Motion and a second. Is there any discussion? Yes.
It's 10:42, we have till 1 o'clock, and I just think we should utilize our time to make some legislation happen.
There is a Governmental Operations Committee, IFS, after we adjourn. Is there any conflict with the Engrossment Committee or the clerks on that? It is immediately following session. There is a committee meeting at GovOps.
Doesn't say it on the agenda.
Just say IFS.
There is an IFS meeting. GovOps was left off of that IFS heading, but there is an IFS meeting. Was there any conflict with any of the members on governmental
Yes.
operations?
Oh,
That's correct.
Okay. Yes, Congresswoman Pratt.
Could we recess and go engross, and we can get it done here and start GovOps at 11? Is that okay? 11-ish?
Congressman Walker.
I'd be surprised if that could be done in 10 minutes.
We're
And
good.
if you guys want to utilize the lunch hour, knock yourself out. and Come back in at some point then, but there's a meeting at 1 o'clock then as well.
Yeah.
If you don't mind, I'll ask Legislative Council, how long would it take for that bill? Are you prepared to do engrossment?
If Madam Speaker, members of Congress, I need at least 20, 25 minutes probably to get those ready to go for sure.
Thank you. I think Congresswoman Edwards withdrew her motion.
If you want to work, if you want to come back at 12:30, then I'm okay with that, but I don't want to get into it. I didn't realize that was a meeting. I really didn't make that suggestion, so.
And
Yes,
we're on the
there is.
committee.
I will move, I'll make that same motion and move to recess until 12:30. Is your meeting immediately following session until 12?
Yes.
Is there a second to the motion? Seeing none, motion fails. Congresswoman Edwards.
Well, as promised, I have a motion to vote on a modified Rule 7. And I have copies for everyone, so I move for a 3-minute recess to hand it out.
Motion for a 3-minute recess so we can get copies of a rule. Is that a second? Motion dies for lack of a second. Congressman Walker.
I would withdraw this comment under discussion.
Any Congresswoman Edwards?
Well, I made that motion. And then I have a point of order on the jurisdiction of the committees. Because the rules set the jurisdiction of the committees and we're not following the rules. So if somebody wants to suspend the rules on the jurisdiction of the committees, fine. But when you look at our rules, they have the jurisdiction of the committees and we're not following it. And I made that comment last week and asked you guys to look at the rules and be ready to talk about them. And here's a day where it's 10:45 and it's a session day. I don't know why we keep putting important committee meetings bumped up against our session, but this is the time that's appropriate to do it, and now you don't want to do it. So I am going to call a point of order on following the rules with respect to legislation that's assigned.
What is the point of order?
That the
Again.
legislation is not assigned according to the rules. And I don't know why we have these rules that have all these details in them if we're not going to follow them. And I agree that they're outdated and antiquated, but I can't get anybody to even look at them to fix them.
Do you have specific pieces of legislation that you would like for a point of order ruling, Congresswoman Edwards?
I would direct people to rule 7.4, standing committees. 7.4, 6, E says that the Boys and Girls Club should be considered by the Health and Social Services Committee, that burial assistance should be considered by the Health and Social Services Committee, that the daycare should be considered by the Health and Social Services Committee, that any children's services should be considered by the Health and Social Services Committee, that the employee club should be considered by the Health and Social Services Committee, so those are ones for that committee that I have point of order on.
Give me just a minute. We're going to probably need this. Do you have them all written down?
Madam Speaker.
Okay. 1 minute, please, Congressman. Okay, on rule, let me get what Congressman Walker says, and then, now I'm still ruling on point of order. Okay. It says in Rule 7.4.2, a committee's subject matter jurisdiction extends to all matters reasonable comprehended in the name of the committee. A committee's particular jurisdiction extends to any bill, resolution, proclamation, or other measure referred to it by the Congress, including review of budgets of agencies, boards, and commissions reasonably encompassed in its subject matter jurisdiction.
Right.
So, I would like specific pieces of legislation that you feel like are assigned to committees. You need to give me legislative assignments instead of, the point of order is on the rules, or is it on the legislation? I guess that's my first question.
Point of order is that the Congress didn't assign, Congress didn't assign any of the bills. The Speaker signed the bills. But second, the Speaker's assignment does not comply with the rules. My point simply is, and you guys know the point I'm making, I asked you last week to look at these rules because they are jacked up, for lack of a better word, and to please provide me a time to make a motion so that we can fix them. And I can't get anybody, does nobody care?
Congresswoman, you're suggesting you suggested a recess to put rule changes in front of the committee. Might I suggest that you supply that to the body of Congress so we'll have the ability to look through it and possibly do this work tomorrow? Okay, thank you. Congressman Walker, did you have anything?
Something real similar to that.
Okay, thank you. We are still on motions and notices. Congressman Walker.
Governmental Operations Committee will meet immediately following session.
Thank you. Thank you, sir. Congressman Pratt.
Cultural Committee will meet 4:30 to 5:30 today.
Thank you, Congresswoman. Congressman Shaw.
Health and Social Services Committee will meet at 3 o'clock.
Thank you, sir. Congresswoman Edwards.
I'll go even one better. I'll take the proposal back to the Congressional Rules Committee to go over it in committee so that everybody that wants to attend once again can go over it and get on committee. But I'm embarrassed, you guys. We worked so hard on these rules. And we have a set of rules that have run-on sentences that don't make any sense and they need to be fixed.
Okay. Is there a vice chair for education? I see it's meeting today, but Congressman Hamilton?
I am the vice chair. Education's meeting at from 1 to 3.
Thank you, sir. Are there any more motions and notices? Congressman Supernaw.
I just want to mention to the Congress that on the health insurance, I'm going to be looking into that because if we have a $700,000 shortfall, which depends on the claim, but I think we discussed this, or John Yeck brought this up to me the other day, that even if we increase the premium, the employee's contribution $100 a month, it wouldn't even make up that deficit. And I think, I'm just curious as to how that figures into our expenditures as we respect the projected income. I'll just put you on notice, we'll be looking into that.
Okay, thank you, Congressman. Congresswoman Edwards.
Move to go to the committee of the whole to discuss the self-insured portion of the employee health insurance plan.
The motion, is there a second?
I'll second it.
Seconded by Congressman Supernaw. Any discussion to the motion? All in favor of the motion say yes.
Yes.
Are there any opposed to the motion? We are now in the committee of the whole to discuss the self-insurance plan of the nation. Congresswoman Edwards.
Well, this happens from time to time just for the benefit of some of the congressmen that haven't been here before. This happened from time to time, or as I understand it, and Congressman Yeck can explain it better. We're partially self-insured, and we get hit with some, from time to time, with some pretty big claims that we then are required to come out of pocket. By that I mean appropriate tribal dollars to cover. Did I say that right?
I think so.
So, Congressman Yeck might be best to speak to the issue of how we might change that, or what we might do to not have that happen in large sums from time to time.
Yes, Congressman Yeck.
I don't know that I have an answer for that. I mean, we can't determine who's going to get sick and have large claims. My suggestion to Congressman Supernaw is that to help offset part of the cost to the nation, that we increase the employee's share of what they're paying. Because I think right now they pay $20 a month. The tribe covers the rest of it, which I don't know what it is now, if it's $600 or $700 a month.
600.
But if there have been large claims that have hit the fund, then Ms. Catcher probably needs to identify those and let us know if I don't even, it's been so long since I dealt with it, I don't really remember how that worked. If the stop loss was 200,000 or what it is, but, you know, if we have 2 or 3 people that hit that top number, then yeah, that takes a big hit on the fund. And in the past, we did have to come to Congress and ask for additional dollars to cover that. It's costs a lot of money to operate that.
Congresswoman Edwards.
Well, it seems to me we either need to start appropriating to a fund for that purpose, or we need to come up with, to me, this is in line with the discussion about indirect costs. We need to come up with a law that sets out how those decisions are going to be made with respect to how much you're going to charge for health insurance, what's going to go into the indirect cost pool. I mean, I don't think we've actually delegated that, but we haven't taken it on ourselves either, so it's time for us to become, I think, more proactive in our responsibilities and make some decisions about these. Who's going to make the decisions? Is it going to be Congress? Are we going to delegate it out? But one or the other, we need to do that.
Thank you, Congresswoman. Congresswoman Buffalo Head.
I'd like to hear from the executive on this.
Assistant Chief Redcorn.
Thank you, Madam Speaker. The Attorney General of the Osage Nation and the Human Resources Director are working on this very problem. There are some methods that other tribes have taken that involve using the Affordable Care Act to give tribes an alternative method. I believe the Citizen Potawatomi happens to be one of them. And as opposed to paying, since we're paying out of pocket up to a very high place where the co-insurance kicks in, that instead you simply set that employee aside and pay their Affordable Care Act premium, and then the U.S. government picks it up instead of us having to pick it up, to be perfectly plain spoken about it. So I believe some other tribes have utilized that. They're studying the issue right now. This is totally anecdotal. Please don't hold me to this, but they estimated that if we could have employed this last year, just on the executive side, we probably could have saved about $1 million. So that's just talk. I've been briefed on it. I have not been directly involved in it. But Congress can do what Congress can do. I'm here to tell you that we're working to address the problem. Thank you.
Thank you, Assistant Chief. Congresswoman Edwards.
For the Assistant Principal Chief. So, like the way the indirect cost proposal was presented, I mean, are we going to present it to us and tell us this is what you need to do, or is Congress going to be involved in the negotiations and the discussions, and then also have a say, since we're the budget people, in whether that is actually implemented or not? Because I have to tell you, as you know, this year with respect to indirect costs, the executive branch presented us a budget and said, this is what we're going to put the indirect cost rate at. But frankly, it seems to me that since Congress is in charge of the budget and appropriations, Congress should have and does have a decision in that as well.
I'll limit my comments to germane comments with the motion that was used to go into executive session, and that's on the insurance issue. I'm not sure, as you can tell, I'm under the weather. I'm not exactly sure how the indirect cost thing applies to this issue. It doesn't mean I can't be educated on why it applies, but right here at the moment, I'm just trying to comment on the
My question
on the
had to do
insurance.
with the process.
Well, I'm not exactly sure. I'd have to go study on it for a while, but I'm not exactly sure why the executive branch, without any assistance from Congress, couldn't implement a series of measures that purchase the insurance Affordable Care Act insurance for particular employees that were chosen. I would have to study on that to find out. It's being explored by the Attorney General and the Head of Human Resources, which I think is entirely appropriate.
Thank you, Assistant Chief.
Thank you.
Congresswoman Bucklehead.
Well, my suggestion is that if there's anyone on Congress that wants to be a part of all that, they can ring the Attorney General or the Director of HR and ask if they can be included to sit in on the meetings and help with whatever the process is of looking into alternative options. Is that
It's a good suggestion.
I do think that's a good suggestion, but I'll mirror what Congressman Supernaw said in a previous meeting. If we don't know what's happening, how do we know to show up?
Congressman,
I'd like to
Assistant Chief Redcorn.
I'd like to respond to that comment because the word blindsided was used in the earlier meeting that has now been referenced. And I'm just here to reinforce what Chief Staninger has said over and over and over again. There's no gag order here. None. Whatsoever. No member of Congress has been kept from talking to any member of the executive branch. So if any member of Congress wants to know what's going on in the executive branch, just ask. Just call that person up and ask. You don't have to go through us. You don't have to clear anything. Just ask. Thank you.
Thank you, Assistant Chief. Congressman Supernaw.
I don't know what that has to do with this discussion, but since we started down that road, well, there's just a lot of things that could be going on that we don't know about. We wouldn't know to ask.
Point taken, and I think we've gotten a little bit off of our subject, but that was a good.
Back to the, what we're in open session for is, if a lot like that, $700,000, we're either going to have to increase the amount that the employees pay into the fund, or we're going to have to provide some kind of appropriation, because it's likely that's going to continue. I mean, based on the amount of claims, of course, but I think you can be pretty well assured that we're going to have a deficit again next year. And when you double that, I'm just really don't have the answer. I don't know how that figures into our projected income. We have we can, with some assurance, predict a loss next year also.
Thank you, Congressman. Congresswoman Edwards.
Is there an amount appropriated to cover that loss?
I've got questions, not answers.
I'm not aware that there is anything to appropriate that loss, and I think that what she said was that was did she not say that it was figured out until the end of a fiscal year? That it was Congressman Yak, yes.
I don't know how it currently happens, but and we work with the Homes organization, and they would meet with a treasurer and executive staff, and they would analyze the spending and the claims for the previous year to help us determine what we would need to put into that fund, or basically charge the programs for insurance. So that number is, I'm guessing, evaluated annually to determine, at one time I think we were maybe just paying $550 per employee, and now it's up to like $750. So they might come in and say, okay, you guys were short $700,000, so next year you're probably going to need to bump that up to $850. It's all going to come back on us to allocate money to that fringe line item to cover this shortfall. So whether we do it in one big lump sum payment, say, hey, we need $700,000, or they say we can allocate it over a year, I think that may be how it's handled. Is there another way to reduce the cost? I think that's our biggest concern, is how do we reduce the cost to the nation? And I don't know that, we may be looking at two different issues here. One is, why is it so, how do we pay for it? And the other is, how do we get it lowered? Because we pay for it by them analyzing and say, this is what you're going to need to cover. But
We want to follow up to what he said.
to reduce it, we have to either pay for your employees, or require the employees to contribute more? I don't know.
Congresswoman Edwards.
Well, and this goes back to rules, the Appropriations Oversight Committee, to me, should be getting that information well in advance of budgets every year so that we know, guess what? This year, the amount of funding that's going to take to cover employee health benefits is going to be $7 million instead of $5 million, because we're budgeting closer than we ever have before. And if we're going to do that, we need some formal recognition from the treasurer of, and probably, to me, a seat at the table as to what we're going to do about this. That was my point from the beginning. And I think it goes a little bit more than just, hey, calling up and saying, can I sit in? I think we need to send a delegate or a representative of the Congress to these negotiations.
I have one more question, Congressman Yak. Have we been self-insured since the nation has been established? How many years have we been a self-insured, partially self-insured nation?
10 years, maybe? I don't know. It hadn't been a long time, but it's...
So would it have been since 2006, or was it after 2006?
I can't remember.
Okay. And then my other question is
I think it was prior to 2006.
I think that the employee, I'm not sure if the employee portion is still $20 for insurance, or if it's gone up. Could you help me with that, Assistant Chief? What's the employee portion of that?
Should never let Callie leave the room. I don't think that's gone up. I certainly think that we would have been aware if it had.
And that's a monthly charge.
That's a monthly fee. We have not passed those on to the employees as far as I know.
Okay.
And I am not in the middle of this issue, but since I sat back down, the legislative analyst has informed me that if the nation goes to some solution that involves the Affordable Care Act, that it probably would require, in a tribal context, it does require a resolution of council in most cases, in this case it would be Congress. And of course, if there is some special appropriation for those funds, we would obviously come back to Congress. So I think there's probably some federal guidelines there that would help guide our actions. I hope that's helpful.
Thank you, sir. I had Congresswoman Edwards and then Congressman Pratt and Congressman Shaw.
I noticed that some of the coverages under our policy have changed because I found out about it by wondering why something that was covered the year before was no longer covered, and I was told that our benefits changed. So I'm not saying that there hasn't been things that have gone on to try to counter some of our expenses, but I'm not sure that changing the co-payment from the employees is one of them.
Okay. Congressman Shaw.
I don't have any answers, but a couple of comments. We talked about that as a nation we've experienced multiple large claims that have been drained on the self-insured fund. And I'm assuming that's multiple claims that are in excess that are close to or get to 200,000, because the stop loss insurance would pay above that, but you still have the first 200,000, which is, if you get enough of those, that's a drain on a fund. And so one thing could be to look at stop loss insurance plan policies that may include a different amount, lower amount. And you'd have to offset the increase in premium versus the number of claims that are in excess of 200,000 and what you would save. $20 a month is an incredibly low copay. I'd love to have that for our employees, but as the premiums gradually rise, to have that fixed and the nation's costs go up, the money has to come from somewhere if we have nothing else to supplement the fund that covers those claims. As far as the Affordable Care Act, the only way I know that tribes are using that to their advantage, and compacted tribes can actually sponsor those patients who come to the clinic that have no resources, no insurance, not eligible for Medicaid or Medicare, just have no resources, whose incomes are substantially below, I think 3 times the federal poverty level, that allow you to sponsor their premium and perhaps even get some cost offset, so that the cost of the premiums is less than the cost you would pay for contract health. And so basically it makes your contract, it's now called purchase preferred care dollars, go longer. Haven't heard, just don't know, I haven't heard about all aspects of that, but haven't heard it being used for tribal employees yet. But I do know there's a private health marketplace that can be used for employees, so that may be that, but I'm afraid I'm not very knowledgeable about that. But then the benefits, how do you have a Cadillac plan that's got all tier 1 medications, that is all brand names with minimal or no deductible? Mental health services tend to be something that's either widely covered or not covered very well at all, or not covered. That has to continue to be looked at. I suspect that was one of the strategies if the benefits have shrunk a little bit, to try to reduce the cost of the premiums. I would like to think that HR would have enough expertise in trying to look at something that still offers a competitive benefit for our employees, instead of a plan that covers next to nothing, like a catastrophic health plan that has a $5,000 deductible. I don't think anyone's planning to do that, but there are several strategies, all of which have been employed and will continue to be employed. But I think the stop-loss insurance plan, perhaps it covers at $150, or $125, or $100,000. I'm sure the premiums go up, but how much are we spending? How many $200,000 plus claims do we have? I'd be interested in that. Someone knows that. Someone's looked at that. So that's all I have.
Thank you, Congressman. I'd like to state here that we need to get this conversation wound up. We have a committee meeting after this. I saw Congressman Walker, and then I saw Congressman Supernaw, and then we need to wind this up.
If Congressman Supernaw has something he would like to add to it, then you go ahead. I was going to make a motion to come out of committee of the whole.
Congressman Supernaw.
I'd just like to say that I'd like to see the figures on that and see if that deficit is really caused by a few large claims, or is it just a consistent number of multiple small claims that we can be assured it's probably going to happen again next year. And although you can buy insurance that gets excess claims, a company to stay in business has got to charge a premium more than what they think they're going to pay out. So this is an issue that you can see coming from a mile away, and we need to do something about it. That's all I can say.
Thank you, Congressman. Congressman Walker?
Motion to come out of committee of the whole.
Any discussion? All in favor say yes.
Yes.
We are still on motions and notices. I would like to say one thing, that Wednesday is Minerals Council meeting in this chambers at 10, so I would like for members to look at the meeting schedule and see how you want to meet on Wednesday. Just putting you on notice for that. We're having to make a decision right now. We're at adjournment.
I have a question.
Yes.
Do we have to approve the audit report? Have we ever?
That is a good question. That is a good question. Would you like to make a motion?
Move that we approve the audit report presented.
David.
Auditor's report, financial statements dated June 12th, 2015, stamped in June 12th, 2015.
A motion and a second. Any discussion? Congresswoman Edwards?
I have one dated September 30th, 2014, it's stamped in June 29th and July 29th. You're talking about just this one?
This one.
What about this other one?
And the single audit reports dated stamped in June 29th, 2015.
I'm in the motion, the audits are dated September 30th, 2014.
Yes. The September 30th, 2014 audit reports stamped in June 12th, 2015 and June 29th, 2015.
I have a motion and a second. Any discussion to the motion? All in favor say yes.
Yes.
Any opposed? Seeing none, motion passes. We are now at adjournment. Congressman Yeh.
Second.
A motion by Congresswoman Edwards to adjourn until 10, seconded by Congressman Yeh. All in favor say yes.
Yes.
We're adjourned till tomorrow morning at 10.
Don't forget